In March of 2020, states began issuing stay-at-home orders for COVID-19. While the regulations may have helped slow the spread of disease, research shows it had detrimental effects for certain groups of people. In particular, quarantine created an ideal environment for abusers. Reports of domestic violence spiked in the first couple of months of the pandemic as millions stayed home and victims were essentially trapped with their abusers. Dr. Alex Henke and his wife, Dr. Lin Chi-Shu, studied trends in domestic violence during this time and found up to a 6% increase in reports.
With the caveat, of course, that we don't see a lot of the domestic violence in the data, right? If we're just looking at police reports, we're only seeing that fraction. And so there's always some uncertainty as to what percentage of the real amount of domestic violence is that covering. The effect is probably much bigger based upon people who are just not reporting to the police. But nonetheless, we are still identifying this. We can still see this effect, and it's still pretty big, but it's probably even bigger.
Henke is an assistant professor of economics at Howard University. Together, he and his wife have conducted a breadth of research looking at the pandemic's various effects on domestic violence. Their 2021 paper, published in the Review of Economics of the Household, focuses on the very beginning of the pandemic.
We're trying to see this relationship between when people started to shelter in place or stay at home all day, really is what we can measure, and the relationship between that and domestic violence, or specifically police reports of domestic violence.
The researchers used mobile device tracking data to verify that people were at home all day. Henke then crossed that information with local police reports of domestic violence.
And you see this just very sharp coincidence between domestic violence cases and the rate at which people are staying at home, just shooting up, and then it kind of plateaus after the stay-at-home orders, actually. And we find that based upon what time frame you're looking at, we're seeing anywhere between like a 4 and 6% increase in police reports of domestic violence caused by the increase in staying at home.
Henke says economists have various theories on domestic abuse. The results of his study are consistent with the household bargaining theory. This idea says two people will collaboratively arrive at a solution that leaves both parties as satisfied as possible.
And then it adds this theory of expressive violence, where the abuser actually likes violence and therefore is willing to purchase it effectively from the victim by paying the victim. And so there are some normative issues with this theory, and people have taken issue with that, and they propose other theories. But the key prediction of this is that you can find ways to increase the price of violence, and that will decrease the amount of violence. That's the key prediction that comes from household bargaining, is that if you make women more powerful, you give women better options outside of the household, then they're less likely to be victims of abuse because the price of violence has gone up.
So when victims weren't able to leave their homes, the price of abuse went down. No one would be able to see the bruises or notice if a friend was suddenly limping. The couple's research looked at reported cases from March to May of 2020. Henke wants researchers to continue building on this study and looking into the long-term effects of the pandemic. As for future policies,
I would hope that people go for evidence-based policy. They look at all of the literature combined, and they start looking into ways to, expand shelter availability, but also make shelters maybe more robust to the next pandemic or the next wave, and make it so that people can find that space outside of their home if there is some sort of violent incident.
One organization helping to make that a reality is St. Martha's Hall in St. Louis, Missouri. The not-for-profit is a shelter for battered women and children that can house up to 9 families at one time. Melanie Asher is the children's program coordinator at the location.
So families that come into St. Martha's, they are fleeing domestic violence, and they are working on just rebuilding their lives and gaining independence free from abuse. So while they are here, we help them develop a goal plan where they can work on finding employment, going back to school, if there's something that they need to work on relating to school, finding safe and secure housing for when they leave St. Martha's. And so we kind of help provide them with resources to be able to do all of that. So all the advocates and all the staff that work here do a variety of things every day. And sometimes, you're meeting with a woman and offering her support while she's crying to you and talking to you about the abuse that she's been through. And then other days you're scrubbing a toilet. So it kind of just depends. You need a wide range of skills to be able to work here.
Due to limited space, women calling the shelter for help are screened beforehand.
We're not like a place for them to just come and sleep at night. So we want to make sure that they are ready and want that type of program and support when they come in. And then we also want to make sure that this is a safe place. So if they work in the area or their partner happens to live across the street or takes the bus on our street every day, those are big things that we want to look out for to make sure that we're a safe place for them.
St. Martha's location is kept secret from everyone except employees and the sheltered families themselves. Even the women's friends and families aren't allowed to know where they're staying. Asher says this rule is crucial for everyone's safety.
A lot of times when a woman leaves the abusive relationship, that's the most dangerous time for her and for her kids. And it's very common for abusers to try to look for their family, to try to track them down, to try to threaten them. And so because of that, our shelter needs to stay a confidential location.
Though security breaches don't happen every day, Asher says it can be a frequent occurrence. One time, friends of an abuser were spotted multiple times looking around the shelter's location, so St. Martha's worked fast to get the family to safety.
And I'm not sure how they did this, but they were able to get in contact with like a SWAT team to come in and help this woman and her baby escape. And we got them like a train ticket and they ended up moving out of state. And we were able to coordinate with another shelter in a different city to get them out.
The Hall was also recently called upon by another out-of-state shelter to be a contact for a woman passing through the area. They gave her money and resources to complete the rest of her journey to safety. For the women who do stay, St. Martha's first helps them set up individual goals, then a family plan for their children.
A lot of times when families are going through domestic violence, different things like going to school consistently, being updated on all their shots, and having all important documentation like birth certificates, social security cards, those sorts of things, that all gets pushed to the wayside. So when they come into shelter, we kind of help them get that reorganized and structured so that they can move forward independently.
The average stay at St. Martha's is around 12 weeks. Employees like Asher first work to help the women stand on their own and then assist in finding long-term housing. There's no set schedule, so Asher says some women focus on education while others try to track down important documents.
We had a woman who came into shelter, and just yesterday she needed to get something from her house and she knew that her partner was going to be there. So we ended up, talking to her about how to safely go about getting her things, and the police were able to meet her at her house and escort her into her house so she could get the important documents that she needed and then, leave safely. So we kind of help a lot with safety planning, different environments and different things that a woman has to go through on a day-to-day basis. Like if she's going to work and he might know that he works there, how can she do that safely? Or how can she be in the community safely?
And as the women in the shelter learn how to heal from their trauma, so do their children. The center leads support groups for kids ages 3 and up twice a week.
We talk about things like how to stay safe if they see a fight, how to identify their feelings, coping skills for when their feelings are out of control and how to manage them. And then in our parenting support group for the women that are staying here, we talk about healthy discipline strategies. We talk about how to talk to their kids about their feelings, self-care, and then the impact that violence has on kids who experience abuse.
Abuse that Asher says is often passed down through generations.
This is how my dad treated my mom, and my mom treated us this way. So a lot of times it's passed down in that way where, the next person who's higher up than you is trying to gain control over you. And so it's not illegal to spank your kids, but we do ask for everybody who comes to shelter to not use any form of physical discipline because they are working to break the cycle of violence in their lives. But if they're still using physical discipline with their kids, it's kind of counterintuitive.
St. Martha's has been providing this support for almost 40 years. However, 2020 was a year like no other.
So we serve about 130 families a year, but we are getting over 1,000 calls of people who are looking for shelter. And, we don't have the capacity to meet that need. And then when the pandemic started, it kind of magnified that.
They were forced to cut capacity down to housing only 3 or 5 families instead of the normal 9. But this circumstance led leaders at St. Martha's to act on an idea they'd been pondering for a long time.
We had been talking about opening a drop-in center for many years, but that kind of helped push us into making the drop-in center happen, because we realized, wow, there's such a need that we're not able to meet. And, so we're hoping through the drop-in center, we're able to do that more.
The drop-in center officially opened this year as an opportunity for women to get help, even if there's no available spots to live in the shelter.
So they can get assistance with finding housing or applying for an order of protection or learning healthy discipline strategies for their kids, or if they just want to talk through the abuse they've been going through, they can do that at the drop-in center.
And though Henke's research shows that reports of domestic abuse have declined from the initial spike, no amount of abuse is acceptable. As Asher has shared, each instance of abuse can have long-term devastating effects. And though it's not always easy working at a shelter, Asher's part of a team helping abused families survive and move forward.
They wear their hearts on their sleeves and they share their hearts with you. And so to be like a safe adult role model and relationship for them, I think is very important for the rest of their life.
For more information about Dr. Alex Henke, Melanie Asher, and St. Martha's Hall, visit our website, radiohealthjournal.org. Our writer-producer is Kristen Farah. I'm Reed Pence. Coming up next week on Radio Health Journal.
You do run into a lot of these doctors who think it's all in your head. The irony is, it is in your head, it's in your nose.
The rare condition that leaves you constantly feeling suffocated.
Then why elderly men have the highest rate of suicide?
The real risk here, it's not age itself. It's not just suddenly when someone gets older or a male that they're more at risk for being suicidal.
All that and more on Radio Health Journal.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
And I hope that now that Americans have gotten more used to wearing masks, that we will also consider wearing these during periods of high rates of flus and colds.
The benefits of face coverings past COVID. Then,
according to some studies, the McDonald's arches are more recognizable worldwide than the Christian cross.
The global appeal of the fast food chains we frequent and love. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.